to talk about the overdose test numbers that, as you know, were just recently released today. Last month in San Francisco, 39 people died of accidental drug overdoses according to the report. This is over 50% drop in overdose deaths that we're seeing in San Francisco in July compared to July of 2023 when there were 79 overdose deaths. That represents a drop over the year to date of 15%, 15% less deaths in 2024 to date compared to deaths in 2023. While this reduction in deaths is a hopeful sign, the health department will continue to double down on our efforts to expand substance use treatment and get more people into life-saving treatment. Fentanyl remains our focus because fentanyl remains the primary drivers of the overdose deaths that we continue to report. Later this month is Overdose Awareness Week and International Overdose Awareness Day, a time to remember the lives lost to overdose and to share information about treatment and recovery, which do save lives. The department and its partners are holding events throughout the month of August to raise awareness about overdoses and to promote overdose response, training, substance use treatment, and other services to help people addicted to fentanyl and other opioids. The most effective treatment for opioid use disorder are the medications methadone and buprenorphine. These medications reduce the risk of death, in some cases by as much as half. We made concerted, redoubled efforts to make it easy to get these medications. Methadone and buprenorphine reduce the cravings and withdrawal symptoms that can derail and delay recovery. Methadone is as effective as buprenorphine. We often don't talk about methadone as much as buprenorphine, but we want to emphasize that methadone is as effective as buprenorphine, but it has been restricted by excessive regulations at the state and federal level. We applaud the recent federal government for recently relaxing regulations earlier this year. But California needs to make more regulatory changes around methadone access in order to make a greater impact locally. We must continue to break down the outdated and cumbersome and frankly sometimes ridiculous bureaucratic barriers that make treatment hard to access and to maintain. We are working hard to do this with our partners across the city, and Dr. Hillary Kunins will share how San Francisco is working to make methadone, life-saving methadone, more accessible and how greater methadone access will continue to save lives. Dr. Kunins, our Director of Behavioral Health.
Thank you, Dr. Colfax. It is true that methadone is the most regulated medication in the United States. The stigma and barriers caused by this overregulation prevent people from entering and staying in treatment. Can you imagine requiring a person who has heart disease to be physically present at a special cardiac clinic every day to take their medication? That's what new methadone patients need to do to get their daily medication. Currently in California, methadone can only be dispensed from a licensed opioid treatment program, also called a methadone clinic. Under new federal laws, new methadone patients can get up to 72 hours or 3 days of methadone from a hospital or other health clinic. This allows them to start methadone treatment immediately outside the operating hours of a methadone clinic. Under another federal rule change, methadone treatment can be initiated via telehealth, making it easier for people to start the process of getting into care that involves methadone. Additionally, more medical personnel under federal rules, including nurse practitioners and physician assistants, are now able to prescribe methadone under these new federal rules, but not in California. Here, the state must adopt the federal rules before people wanting to start methadone treatment can benefit. Legislation from Assembly Member Matt Haney, AB 2115, would align California with these important and life-saving new federal rules. I can't underestimate how much of a game changer this would be for people with opioid addiction and wanting to enter recovery. DPH currently has more than 2,500 people receiving methadone, and we are working vigilantly to continue to strengthen treatment programs across the city to be able to provide more patients with methadone and support their recovery. We implore our California state legislators to pass AB 2115. Making methadone will save lives. Making methadone more accessible in California will save lives. I'd now like to introduce Dr. Hannah Snyder, who leads the Bridge Clinic at Zuckerberg San Francisco General Hospital, which is one of the first clinics in our state currently administering methadone outside of an opioid treatment program. Dr. Snyder.
Thank you very much. My name's Dr. Hannah Snyder. I'm the medical director at the Bridge Clinic at San Francisco General Hospital. We're a very small but rapidly growing clinic that specializes in treating people with substance use disorders, including opioid use disorder, but not just limited to opioid use disorder. Many of our patients are patients who have recently experienced an opioid overdose. We expanded hours this July, last month, and we are now offering drop-in accessibility every weekday. And we look forward to adding morning and evening drop-in hours in the upcoming months. The Bridge Clinic is not a licensed opioid treatment program, so we're restricted in what we are able to do for people who are interested in starting methadone. But for patients who want to start methadone and are not able to immediately access a licensed opioid treatment program, we have started an initiative offering time-limited doses of methadone in Bridge Clinic while folks are initiating. There are many reasons why somebody may want treatment with methadone but not be able to immediately enroll in a licensed opioid treatment program. But most common is that people come to clinic outside of intake hours. In these cases, Bridge Clinic is able to administer daily methadone up to 3 days while we work to get the patient enrolled into an opioid treatment program. While this might sound like no big deal to somebody outside of the substance use treatment space, it's everything to our patients who want and need an immediate start to their treatment. The doses of methadone that we're able to give manage the patient's withdrawal, and the patients get a supportive introduction to methadone treatment in our clinic. Like Dr. Kunins shared, we are one of the first clinics in the state outside of a special treatment program who are doing this in-house methadone initiation. And one other example is across the bay at Highland Hospital. In the last month, more than 20 patients have begun methadone treatment at the Bridge Clinic, and 3/4 of these have successfully linked to an opioid treatment program. Once state laws align with the new federal rules, Bridge Clinic will be among the first clinics outside of these licensed methadone clinics to give the 72-hour take-home doses that patients need. These greater and less restrictive access to methadone will save lives, and by expanding methadone access, we'll be able to give DPH and other providers more tools to mitigate the opioid crisis. Thank you very much.